But nonetheless, you are joined from various parts of India, and I am hopeful that I'll be able to impart some kind of knowledge and increase your. So, temperature, I'll just go through quickly, then I will give you a brief overview of human adaptation to heat, and then spectrum of heat-related illness, which can be as innocuous from like a prickly heat, colloquially called ghamori in Hindi, to as serious and deadly a disease as heat stroke. And I will be focusing more on heat stroke and cooling strategies because of the paucity of time. So heat is not, this already has been covered when it is called heat wave. So heat is not only a temperature, it is a composite endpoint of 4 factors on human health. Insofar as human health is concerned, we have to consider not only the temperature, but 4 factors in fact. These are temperature, radiant heat, air velocity, and humidity. So as you would see in this slide, unfortunately the temperature, I picked it up from a Western, so the temperature is all in Fahrenheit, but I converted it. Look at the x-axis on the top, 90 degrees. 90 degrees Fahrenheit is about 32 degrees Celsius. So at 32 degrees Celsius, 32 would come across to you as a okay weather. Okay, 32 is not such a severe heat wave. But if there is, and then you extrapolate it on y-axis, at 90 degree of relative humidity, this 90 becomes 122, which is 50 degrees centigrade. So 32 at 90 degree of humidity becomes 50 degrees centigrade for human perception and human health. So we always should factor in not only the heat, but relative humidity, air velocity, and radiant heat also. And this is the temperature measure, wet bulb globe temperature, which measures all 4 and gives us a composite value, which is much more apt insofar as effects on human health are concerned. So this is what we get on Google. If you search Goa weather now, so it will be feels like is 32. Actually, it is 28. So how does human beings adapt to this intense heat? In fact, all heat-related illnesses, more so heat stroke and heat exhaustion, are a disturbance between input and output mechanism. Basically, the body is unable to dissipate the heat which it is generating either because of hard work, namely exercise, which increases it to as many as 20-fold, fever, shivering, tremors, convulsions, thyrotoxicosis, sepsis, and some drugs, or is it because of ambient temperatures? If the input is more and the output is less, we suffer from the consequences of heat-related illnesses. And the method of heat losses are, as we have all read in our physics classes in our childhood, convection, conduction, evaporation, and radiation. Now, the most important mechanism in a normal state of affairs, in our normal state day-to-day life, are convection and evaporation. But at a higher relative humidity, more than 70%, this evaporation, which is sweating mechanism of heat loss, somehow gets blunted. And so, there is one mechanism, conduction, which is a which contributes a very minuscule amount in normal day-to-day life. But when it comes to cooling strategies, this becomes the most important because it is a very fast rate of cooling of human body, this conduction method. And we will delve upon this later in our session. So when we ask people to wear light color clothes and porous cotton clothes in summers, that is what we are referring to. We want to increase their convection because of porous clothes, and light color clothes increase the radiant transfer of heat. And the master of all this phenomena in our body is hypothalamus, which matches the temperature outside to the core body temperature and takes appropriate decisions like increased perspiration, vasodilation. But this is not common in all human beings. This is not equal amongst all. Why is it so? Because as you can see, this is a coronal section of human body. So there's a core in which we measure temperature. Then there's a muscle which varies from people to people. then there is a subcutaneous fat, then there is a vascular skin, then there is a clothing layer. And as you might observe that there are, for all these things, a person can be more muscular, less muscular, more fatty, less fatty. So heat-related illnesses and heat exhaustion, heat stroke are a composite endpoint of on based on human to human. And some people develop this robust physiologic acclimatization to heat-related illnesses. And how does it happen? It happens by increased rate of sweating. Normal human beings sweat as much as half liter to 1 liter. But in trained athletes, they can go as high as even 4 to 5 liters an hour, which is mind-boggling, right? If you see. And plasma volume expansion also occurs. The cutaneous vascular flow goes as much as 20 to 30 times the normal flow. So our body is a pretty effective machine if we see it that way. Decreased Planck, the central blood flow decreases, heart rate lowers with a higher stroke volume. There is a adaptation at a molecular level also in form of heat-related cytokines, which increase our adaptation. But the most important thing for us clinicians to remember in this slide is one, which is in some cases the SGOT-PT can be slightly raised. If we do their urea, sodium, and chloride, they are less as a compensatory mechanism by the kidney to increase our adaptation. But the most important thing for us clinicians to remember in this slide is one, which is it takes several weeks for acclimatization to happen, but deacclimatization takes place only in a few weeks. So in heat stroke, you will have a history that I am an army jawan, army soldier. I run for so many kilometers with a pittu on my back and nothing will happen to me. This jawan goes to chutti and then comes back and assumes the same degree of effort. Then he goes into a state of heat stroke. So a rickshaw puller goes from Delhi to his native place. He's an immigrant rickshaw puller. His body is acclimatized. Now he rests in his hometown, comes back, resumes the same level of physical activity, suffers from a heat stroke. That is a very common factor which you have to take into account in history taking. So the climatization takes place during a period of several weeks, whereas deacclimatization takes place very, very quickly. And then I am taking a segue. This is because the teacher in me can't stop. There is a difference between fever and hyperthermia. This, as a consequences of heat stroke is a condition of hyperthermia. In fever, hypothalamus is wanting the body temperature to rise because by releasing interleukins as a method to combat infection. And there is another term, hyperpyrexia. In pre-antibiotics the first antibiotic came across 150, 200 years back. Before that, there were no antibiotics. So the only mechanism by which body coped with infection was raising temperature.